COVID situation here in the United Kingdom and everywhere else in the world. You don't get this anywhere, but only on Hospital Radio Bedford and on the HRB Breakfast Show. Good morning, Dr. Seshne. You probably can tell from my voice that we're cold. I mean, can't you?
I was gonna say that actually. How are you
Yeah.
feeling?
Yeah, I've been trying to shake it off. I got it from probably two days ago, and yeah, it's getting better now. Yesterday I struggled a bit, but here I am.
Yeah.
So please forgive us if you're listening to us or watching us on live on Facebook, and my voice is a bit croaky. Don't worry about it.
It sounds a bit different, but how are you feeling? Are you feeling okay?
No, I'm fine. I'm actually really good.
It probably
I
just
feel
sounds
good.
like that, yeah.
Yeah, I haven't got COVID. That's for sure. It's just a cold,
Yeah. I think this
So,
is how
yeah.
it's going to be because a lot of people are getting the colds and flus. So for the next, for the next few months, like the next 3 months, it's going to be colds and flu season and also possible COVID. So yeah, I'm glad to hear you feeling okay.
Thank God I bought my cold now, so I don't want to have cold. I don't want to be catching cold in the middle of winter. It's horrible.
I know what you mean. Yeah, it isn't nice because then you're just stuck in bed all the time.
Yeah. How are you, by the way?
No, I'm good. Yeah, no, we're good. We're just getting out a bit more. It was Shreya's birthday on Wednesday. Thank you for the lovely message and everything. And so we just went out to movies.
Girl now, isn't she?
Yes. So we went out to movies on Wednesday. We went to watch Free Guy. I'd recommend it. It's a good movie.
Really? Where did you go and watch it?
We watched it in Oxford.
Wow.
But I must say, that was the first time going to the movies in the pandemic, since we started. So it was a long time. But the movie theater there was empty.
Oh, okay.
There wasn't a lot of people.
I'm sure you were a bit apprehensive knowing you're a bit apprehensive going in, and then you realize, oh, it's quite empty. Then
it was empty.
Yeah, that's all right.
So yeah, and I think, and even when we've been to Milton Keynes, there's not a lot of people going to the movies. I think people have gotten so used to just watching what's on Netflix or Amazon Prime or whatever sort of channels that they use, that they're not actually going out. And because I think it's like an effort to go out, and then you have to be concerned about how many other people are in the cinema. But we're planning to go again on Friday, on the weekend, to watch the 007. And I think the new
one that's come out.
Yeah, but I think that's going to be really busy. So I think it'll be a different
scenario.
And mind you, we went on a weekday. So I think weekdays, obviously, there's not many people going to movies in the evening. Yeah.
That's true. Now, talking about empty, or almost empty cinema halls. On the contrary, when you check out what's happening in the football stadium.
Yes.
Proper full. 56,000, 65,000, and all that. Hey, anyway, by the way, let me just rub this in. I know Jeff is watching.
Yeah.
But Rob, Jeff, North London is red, don't you think? We beat my team. We beat Jeff White's team. If they had beaten me, I wouldn't be sleeping right now. You'll be just taunting me and sending me messages. So Jeff, if you're listening, we smashed you guys yesterday.
Oh dear.
3-1.
That's not going to be. That's not going to be good.
So as I was saying, sorry, before I rudely taunted my brother. The football stadiums are quite full, and then also let's start with this particular story about what's his name again? Let me just get the name. Give me 1 second.
Okay.
And Tom Fletcher of McFly.
Yes.
He's doing Strictly Come Dancing, and
him
and his partner
have tested positive.
They've tested positive. Right. They were doing so. They did so well in the first dance and all that, and now they tested positive. So they've got to self-isolate for 10 days, and hopefully, if everything goes all right, they'll come back and do the dance.
I think we're going to hear more and more people just testing positive. I think more and more people are still going to get COVID, and we're going to hear more cases like this. Yeah, but well done on your football team. So yeah, in terms of people testing positive, I mean, obviously, I think there's been another 58 deaths in the UK, and they're saying that there's a 15% rise in a week, in the total figures. So the numbers are still increasing. So, and a further, so it was 32,417 people have tested positive and 58 deaths. So, and which is an increase in 15%. So there's a slight
Yeah,
increase, I would say, not a huge
yeah,
amount.
yes. I got some statistics from you from your Facebook page the other day, yesterday. But what I'm trying to bring to mind is that up and closeness of Strictly Dances, and not just Strictly Dances,
Yes,
but I think it's going to cause a bit of trouble there. That my wife and I were watching it the other day. We were saying, "Oh my God, in these days of
yeah,
the COVID pandemic, and these people getting closer and closer
yeah,
every day, um, there is a possibility of them catching COVID off each other,
yeah.
especially if they've not one or two of them have not been vaccinated
Well,
as of
that's
yet.
it, isn't it? Yeah. So I
So
think,
yeah, so that's quite an interesting story there. What do you think about Strictly? You think it should continue?
yeah, well, I think, yeah, I mean, Strictly Come Dancing is a very popular, you
Yeah, it
know,
is. It is. I love it.
yeah, it's a past popular
It
show,
reminds me
and
of my mom, because my mom
oh,
used to come
really?
to yeah,
Did your
you
mom
get ballroom
dance?
dancing. My dad was exactly opposite. He couldn't dance to save his life.
Oh, really? No, I also
Yeah,
love dancing. Oh, that's amazing. I didn't know that about your mom.
yeah,
Um,
yeah. She's a great dancer.
so did she do professional, or was it?
No, I wasn't professional, but she won a lot of awards doing ballroom dancing or the
Yeah,
salsa and all the stuff like that in them days.
yeah.
Yeah.
Oh, that is so good to hear. Sounds like she was talented, and yeah, no, I so obviously they're gonna miss the next show, and it's going to obviously affect the people that watch, the viewers. So so Tom Fletcher and Amy Dowden have tested positive, as you said, and they will have to self isolate. I think if you've tested positive, the guidance is that you have to self isolate. So I think they just have to go by the rules, and they can't break the rules. And especially being people in media, it's really important that they obviously set an example, because everyone else will be, all eyes on them. So yeah, it is a shame, but I think it's just following the protocols.
Right. Okay. Let's go back to something that you mentioned whilst earlier on about the 15% rise in cases in the
Figures,
United
yeah.
Kingdom. Yeah. What would you attribute this rise to? Would you say it's because we're entering the winter months, or would you say that people are becoming what's the word? This word?
More complacent, is it? Or
Complacent. Yeah.
yeah. I think it's a mixture of things. Schools have just gone back in the last 2 weeks. We know that people are, are are more complacent and obviously going out a lot more, and there's less social distancing and more gatherings, and the rules have relaxed a lot. So I think it's a mixed combination of different factors. It could also be of the different variants that are now that are around, in terms of the COVID variants, the SARS-CoV-2, and then the Delta variants, and the other variants, the Kent variant. And also, it could be, because not everyone's vaccinated. Those people that have been vaccinated, it has helped stopped, in stopping them getting the COVID-19. But having said that, we know people that have gotten vaccinated and yet still are getting COVID. So, it doesn't mean that if you're vaccinated, you're not going to get COVID. But at the same time, it has helped a lot of people. So I think it's a combination of different things. And it could be as well that we are entering the cold and flu seasons, and we are therefore going to see a lot more cases of COVID, and colds and flus.
Right. So should we start panicking?
I don't think we should start
Yes.
panicking. I think we
Yeah.
just need to the 15% rise in figures of the last week. With the UK having on Saturday it was 122 new deaths in the UK with 31,348. That's quite a lot.
That's
Um,
a lot.
yeah, and then obviously now the figure is um, 28 deaths with 32,417. I think what it's showing us is that the numbers are still rising, people are still getting infected, and the people are dying as well from COVID. And it just shows that we still need to take care. We need to social distance if we can, wear a mask, hand sanitize, isolate if you have any symptoms, or if you come into contact with anyone that's tested positive, and obviously get vaccinated if you feel you need to get vaccinated, and also the booster jabs. So yeah, it's obviously, I must say that from what I've been seeing is a lot of people are wearing masks. I'm
Yeah.
not surprised. A lot of people are still wearing their masks. When we go out, we are wearing masks. But I think a lot of people are still like, I've seen as I've drove. While I'm driving, I usually look at the cars around me, and like even in taxis, people are wearing masks. And when
Yeah.
you're going anywhere, people are wearing masks. So I think people are still being quite strict. And even though the government, relaxed the rules, people are still, adhering to the guidance.
Yeah. So if you would wear your prediction hat for a minute, can you see a future lockdown?
I'm hoping not. I don't think that's going to
Right.
happen. I think they are going to talk about it, and maybe it's a tactic of the government in order to try and get people to listen more and to take it a little bit more serious, and also to take care and be more cautious so that they don't either get COVID or they don't spread it. So I think maybe it's like a strategy on the government's part to highlight that there's a possibility there might be a lockdown, but I don't think it's going to come to that. I think we have got gained control of the virus, and it's just about continuing with that control, reducing the risk of people getting it, reducing the spread, reducing the number of deaths, and reducing the burden on the NHS, whilst the rollout of the vaccines continue and the booster vaccine. So I don't think we'll have another lockdown.
Right.
That's my feeling. I don't know
Yeah.
what you think, but that's my feeling.
No, I think I'm with you on that. That's right.
Yeah,
Exactly what you think is what I'm thinking right now. I don't think there's going to be this future lockdown.
yeah,
And honestly, I hope there will be. But then again, we need to make sure that there isn't
yeah,
by helping ourselves and others,
yeah,
wearing masks and hand sanitizing and doing the things that
yeah,
we did when when lockdown started, and all the instructions that we got, wash your hands, do this. I think we should just continue doing them. We should be used to doing them, and I am very used to doing them now.
yeah,
As soon as I sit in the car, I reach out for the hand sanitizer, which is in both corners of both pockets of the front part of the car.
yeah.
There's one here, there's another one there. So as soon as I sit in, I just reach out for it. It's become automatic, and I think we should just continue doing that, so we can
I
help
think
ourselves and
so.
help others. Yeah.
Yeah, I'm 100% with you. I don't think we'll have a lockdown. I think it might be a strategy. Now, when you asked me that question, because we had been talking about it for a few weeks, and Boris Johnson did announce that, a few times he's announced to 10 Downing Street, but obviously that's met with some reservations from other people. So there's ambivalence about it. So some people are for lockdown, some people are against. But just thinking about it, it feels like it's a strategy. It's like he's telling us, if you are not going to listen to the guidance, if you're not going to maintain social distancing and keep yourself safe and others safe, then there's a possibility that we are going to go into another lockdown. And no one wants a lockdown. So it's
Yeah.
quite clever actually to do that because no one wants to go back into lockdown. We've been there 3 times. We've had to, I mean, last year, Christmas, our plans, your plans, our plans were all cancelled because we had to, we couldn't go anywhere being in Milton Keynes. So I don't think anyone wants that. They still want to spend. Christmas is a really important time.
I want to have a big Christmas dinner with my family.
I'm sure. So that's it. So everyone wants to have this big Christmas. They want to meet up with their family safely, hopefully. So I think it's a way of ensuring that that's going to happen. So it's like if you are going to listen, then we won't have a lockdown. But obviously, if you're not listening and people around are being careless and reckless and negligent with their lives and with others, then obviously we're going to have a lockdown. But I don't think it's going to happen. That's my intuition that I'm getting, but it could change. If something changes, I think it could, but I'm not feeling that that's going to happen. And I hope so. I hope not.
Have you got any news at all on the travel industry?
So yeah, in terms of travel, I mean, it's very much the same as what we've been hearing about the different lists and about the testing. But obviously, in terms of traveling, if you just going back to like the normal situation, if you are in contact with someone who's got COVID, um, then and you're not vaccinated, you have to self isolate for 10 days. But if you are vaccinated, you don't.
If you come into the country, is that what you're saying?
No, just in general, So yeah, so there's a few bit of news. So Ireland has ended the mandatory hotel quarantine.
Okay.
So you no longer, so as it stands, if you enter Ireland, you don't have to quarantine for 10 to 14 days. So they've ended that.
Okay.
Yeah. So,
so they've ended the hotel quarantine, but do some people still have to quarantine at home?
No. So they say
no,
and also Northern Ireland are relaxing the rules on COVID testing for international travel from October, in line with the rest of UK. From the 4th of October, fully vaccinated travelers will no longer have to take a pre-departure test when arriving from non-red list countries.
When arriving from?
Yeah, that's what they're saying. Yeah.
Okay, so does that affect the whole of the United Kingdom from the 4th of October?
It seems so. That's what they say.
So if for example I travel to Africa for work and I'm coming back, I wouldn't need the pre-departure
test.
Okay, that saves a bit of money there, doesn't it?
It does. So that is really good news. So yeah, so in terms of quarantining in Ireland and obviously this, there's actually quite a lot of news in terms of the travel industry. So so South Africa wants their country off Britain's red travel
list. Okay.
Yeah.
What's happening to that traffic light system now? Because there's all I'm getting a bit confused here because one time I hear there's no more red list and no, actually there's no more amber list. It's either red or green, and another time I'm confused. What's going on, please? If you can explain.
So yeah, I think so. We still continue to have the red, amber, and green list, and obviously certain countries like South Africa, one of them is they're still on the list. So so what they're saying is from the 4th of October, so that's coming into effect next week from 4 a.m. Monday, 4th October, the rules for international travel to England will change from the red, amber, green traffic light system to a single red list of countries. And simplified travel measures for arrivals from the rest of the world. The rules for travel from countries and territories not on the red list will depend on your vaccination status. So they're going to do away with the traffic light system. It's just going to be a whole list of red countries, which obviously you will not be able to travel to. If you arrive in England before the 4th of October, you need to continue with the current rules. This means you must book and take any COVID tests you need and follow the quarantine rules that are in place when you arrive to England. So, travel from the rest of the world if you are fully vaccinated from 4 a.m. on Monday, the 4th of October. You will qualify as fully vaccinated a- if you are under an approved vaccination program in UK, Europe, USA, or a UK vaccine program overseas, or with a full course of Oxford, AstraZeneca, Pfizer, BioNTech, Moderna, and Janssen. And they've given specific countries: health body in Australia, Antigua, Barbados, Bahrain, Brunei, Canada, Dominica, Israel, Japan, Kuwait, Malaysia, New Zealand, Qatar, Saudi Arabia, Singapore, South Korea, Taiwan, or the United Emirates. So formulations of the four listed vaccines, such as AstraZeneca, Covishield, AstraZeneca, Vaxzevria, and Moderna Takeda, qualify as approved vaccines. You must have completed a course of approved vaccine at least 14 days before you arrive in England. Where 2 doses of vaccines are required, you need the full course. So you could have two different or mixture of Oxford, AstraZeneca, and Moderna, or vaccinations under two different approved programs from, for example, Australia, Japan, UK, USA, EU, and Canada. Until the 4th, mixed vaccines are only permitted if you are vaccinated, so under those countries. And for fully vaccinated people, you can, if you're under 18 and a resident in the UK or one of the listed countries or territories, or taking part in the COVID trial, so you qualified as fully vaccinated. Um, so yeah. So
I
under
think
the
that
rule, yeah,
through this thing again because I'm still confused about the
yeah.
whole.
No, I think what they're saying is, so from the 4th of October, we're going to have a new system. It's only going to be the red list. And if you're fully vaccinated, you don't have to. So under the new rules, you will not need to take a pre-departure test or take a day 8 COVID test, or quarantine at home, or stay for 10 days after you arrive in England. So before the 4th of October, you still have to take your pre-departure test. You still have to do a day 8 test, and you have to quarantine at home and stay for 10 days. But now, if you're arriving into the UK, you don't have to do that. And that's from the 4th of October. And you need to show that you're fully vaccinated. And obviously, they've given strict rules. So travel from the rest of the world if you're not vaccinated. If you're not vaccinated and you're traveling from another country, from 4 a.m. on October the 4th, you do not qualify under the fully vaccinated rules, or if you're partially vaccinated or not. So if you're not vaccinated and you're coming into the UK by the 4th of October, you will need to take a pre-departure test. 3 days before you travel, you need to book and pay for the day 2 and day 8 test and complete a passenger location. When you arrive in the UK, you will have to quarantine at home or in a place where you're staying for 10 days. And you will need to take the test on the day 2 and 8. So from the 4th of October, red countries. So if you're traveling from a red country, then you will still need to take the pre-departure test and book a quarantine hotel package and a passenger form.
Even if you're fully vaccinated.
Yes. So, but if you're coming from a red list. So upcoming changes to the red list, they're saying it's Afghanistan, Angola, Argentina, Bolivia, Botswana, Brazil, Burundi, Cape Verde, Chile, Colombia, Congo, Costa Rica, Cuba, Dominican Republic, Ecuador, Eritrea, Eswatini, Ethiopia, French Guinea, Georgia, Guyana, Haiti, Indonesia, Lesotho, Malawi, Mexico, Mongolia, Montenegro, Mozambique, Myanmar, Namibia, Nepal, Panama, Paraguay, Peru, Philippines, Reunion, Rwanda, Seychelles, Sierra Leone, Somalia, South Africa, Sudan, Suriname, Tanzania, Thailand, Trinidad and Tobago, Tunisia, Uganda, Uruguay, Venezuela, Zimbabwe, and Zambia. So it sounds like it's a lot of the African countries, apart from Ghana, and a lot of the. Well, what did you think about the Latin American countries?
Yeah, it's a lot of Latin American countries and Uruguay and all of them. And I can't, some of the African countries that's listed, it's a bit surprising to me. Cape Verde. Cape Verde is very, I don't know. It's
quite surprising, these countries, and yeah, very surprising because
it's surprising to me.
Well, India is not on the red list. South Africa is definitely. Ghana is not on the red list. USA, so all the the big countries are not. So yeah, so this is what it's saying. Yeah, it's still.
I can understand why they would add Eswatini, because it's bang in the middle of South Africa, isn't it?
Yeah.
So yeah. Anyway, you won't believe it. We've just got 5 more minutes to go, and it's just I wanted to ask about booster jabs.
Well, booster jabs will have to
for just 1 minute before we do the numbers.
Yeah, booster jabs. I'm glad you brought that up, because a colleague of mine actually sent the reminder yesterday, and we've been getting reminders.
Yeah, I got a text as well from my GP about booster jab.
Yeah,
my booster jab.
So the booster jabs is something that we all, everyone's going to be obviously offered at the moment. So, so the world's first person received the first COVID vaccine booster jab. So 2 days ago, Margaret Keenan, she was the one that received, 91-year-old grandmother. She became the first person in the world to have the COVID-19 vaccine booster jab, and she's urging other people. So she returned to the University of Hospital in Coventry, and she got the booster jab. So that's obviously in the news. Yeah.
So that's something that's going to happen, really. Okay.
Yeah. So she definitely.
Do the numbers now.
Yeah. So we can talk more about the booster jabs and about what's being offered and the guidance and who are they rolling it out to first. But I mean, what are your thoughts on the booster jab?
Well, I think they must have researched, and they know that it will help. And I'm going to take mine as soon as my time is up to get it. Definitely. Yeah. So
I think
I'll encourage everybody to take it. I mean, if you don't want to take it, it's entirely up to you. That's my disclaimer. I'm not, and Dr. Seshi and I on this show, we're not saying that it's a matter of it's a must that you must have it. But I'm going to get it. So I think so.
So it's just a matter of people deciding, making that decision. But we can talk about it more tomorrow. I'll just carry on with the numbers. And as you said, a disclaimer, whatever advice we give, it's just advice that's current in the news. And we're not suggesting that you do need to take the booster, but that's the evidence that's there, encouraging people to get the booster vaccine. So in terms of the Worldometer numbers, as of today, the 27th of September, we have coronavirus cases on the Worldometer is 232,608,482 cases, and total number of deaths is 4,762,082. So the number of deaths is quite high. Total number that have recovered is 209,242,666. And then in terms of the top 5 countries, we have USA number 1 with 43,750,983 positive cases. Total number of deaths 706,317. India number 2 with 33,678 positive cases, 786, with total number of deaths is 447,225. Brazil is 21 million, number 3 in the world, 21,351,972 positive cases with 594 7,484, and UK is 7,600,000, and number 4 in the world, 7,664,230 positive cases, with 136,168. And Russia is number 5 with 7,420,913 positive cases, with 203,900. And South Africa number 17 with 2,896,943 positive cases, with 87,052 deaths. And Ghana is quite low down. We've just reached 7:30. With so Ghana's 104 now. It's moved to 104 with 100.
Yeah, it used to be 107. It's jumped up.
Yeah. So it's 126,621 positive cases, with 1,146 positive cases. And just to complete the 24-hour figures in the UK in the last 24 hours, 26th of September, as I said earlier, it's the same. It's 58 new deaths with 32,417. The day before was 127 new deaths with 30,686. The day before that, wait for it, 180 new deaths.
No way.
On the 24th, over the weekend, with 36,511. And the day before that, September 23rd, was 182 new deaths with 35,955.
Well, that's not good.
So as we usually see, the numbers towards the end of the week usually are higher. And as we start the week, the numbers are lower.
Anyway, thank you very much for the session.
Thank you, Pogu. Have a fantastic. Hope you've managed to recover from your cold, but you sound amazing as always.
Thank you. Thank you. And I'll make sure I get some ginger and lemon and garlic.
You need you need a good curry, and you need lots of ginger and garlic.
And plenty of sleep.
Yes, bed rest, doctor's orders. Take care. Have a fantastic and chicken soup. I don't know if your mom ever made chicken soup, but my mom.
Even me, I make really good chicken soup. I can make myself one now.
Yeah, so Ferdy believes in chicken soup.
That's a good thing. I'll make myself
chicken soup. Or we make a rasam, is an Indian dish which is amazing, and that cures any cold and flu. It's a pity you weren't close by. I would have made it and sent it over to you. But take care. Have a good rest. Lots of love from all of us, and hopefully I'll see you tomorrow.
Hopefully.
Love to everyone, and let's spread the love and not the virus.
Yeah, my love to the family. And just sure you haven't forgotten here. I'll see you soon.
Okay. Thank you so much. Bye. Thank you. Bye-bye.